Good afternoon. My name is Mark Smith. I'm the Chief Medical Officer at Henry Ford Allegiance Health here in Jackson, Michigan. I want to thank you for attending our Facebook Live media briefing. This is, again, where we coordinate with the Jackson County Health Department and Henry Ford Allegiance Health to coordinate our messaging around our COVID-19 response. Our goal is to keep our media partners and community up to date. As of 12 p.m. today, there are 16 cases of COVID positive in Jackson County. 10 of those individuals are currently inpatient at Henry Ford Allegiance Health, and we have 0 deaths in the county at this point. We currently have also 11 persons of interest within the hospital, and again, persons of interest means that they are being monitored for symptoms as well as waiting test results. These patients, again, are located in private rooms on 2 different floors within our hospital and isolated from other patients within the hospital. I would now ask Dr. Hackert from the Health Department to make some comments.
Hello. So I'm Dr. Pamela Hackert. I'm the Medical Director for the Jackson County Health Department, as well as an occupational medicine and preventive medicine public health physician here at Jackson Health Allegiance. And I would like to go over the total number. As of 12 o'clock today, the state of Michigan is reporting 2,915. The most recent number of deaths, which is actually the one reported yesterday at 2 o'clock, is 43. Of our 16 positive COVID-19 cases in Jackson County, 9 are male and 7 are female. So I'd like to also talk about 2 different specific events that occurred in the county, and these events are being reported specifically and separately from other potential exposures because they're larger events and we do not have all of the names and addresses of people who may have attended that, which is why it's important to go over this, both from a public health standpoint. They released a press release yesterday, as well as updating our followers here on Facebook Live. So these 2 events, the first of which is March 11th, Wednesday, March 11th, at the Michigan High School Athletic Association Boys Basketball District Tournament game at Concord High School. There have been 6 cases associated in connection with this game. For large events such as this, direct interviews, as I mentioned, cannot cover all the potential exposure, such as handling a water faucet or someone sneezing or coughing as they walk by you. That's why we do not release the individual 6 cases' names. Those people should be able to contact their contacts that they know were at the event and let them know. But for those people who may have attended that event, we are asking that you should consider whether or not you currently have or had symptoms of COVID-19. If you did, you should alert your contacts that they may have been exposed and to call the health department. And I'm going to say this phone number and I'll say it slowly. It is 517-788-4420. Your first option will be press number 9 for COVID reporting, and that's the one you want to do. The second event is also on Wednesday, March 11th. This was at the Community Bible Study held at the Jackson Free Methodist Church that occurred at 9:15 to 11:15 in the morning. And this is located at 2829 Park Drive in Vandercook. Again, anyone who was at the church during this time has been potentially exposed to coronavirus. And again, we're asking that you monitor your symptoms or recollect over the past 2 weeks if you had any of these symptoms, and to let the department know, health department know, and also to notify your close contacts. Since I am suggesting you monitor yourself for symptoms, I would like to take a moment to remind you what the symptoms are. They are fever, cough, and/or shortness of breath. Other less common symptoms, but now that we have a larger number of cases, we are also seeing these, and is losing your sense of taste or smell, headaches, and/or stomach or intestinal issues. Remember always, though, this is the most important thing. If your symptoms worsen or if you have other symptoms not associated with COVID-19, to the point of needing emergency medical care, please call 911 and notify the dispatcher of your symptoms.
Thank you, Dr. Hager. Now we'd like Dr. Cortland Catan to speak.
Good afternoon. I'm Dr. Cortland Catan. I am President and CEO of the Jackson Health Network. I'm also Vice President for Population Health here at Henry Ford Allegiance, and I'm the Medical Director for our Occupational Medicine program. I'm also a preventive medicine or public health physician and occupational medicine physician like Dr. Hackert. So my primary efforts or my primary responsibility in this COVID response has been to lead the drive-through screening efforts that you've seen in the parking lot at 1 Jackson Square. I want to provide some updates about that specifically. But first, I want to emphasize a couple things. We continue to advise people that are otherwise healthy, don't have any immunocompromised, no chronic medical conditions, and if they do develop symptoms of COVID-19, that they should continue to stay in their homes, self-isolate. It is perfectly safe for them to manage and recover there on their own. They don't need to be tested. They don't need to come to the hospital. It is a flu-like illness that can be managed at home, like other illnesses you've probably experienced during the course of your life. So we continue to encourage to take that approach for those individuals. That's also the case for close contacts. So if someone in your home develops symptoms of COVID-19 that Dr. Hackert already just described, we would want those individuals to also stay isolated for that 14-day time period. This is the concept of social isolation, and we want to keep you separate from other individuals so that you don't risk spreading the disease. Specifically about the drive-through, I want to make sure I clarify some things about how that's operating. The first thing is we want to make sure that people have appointments when they come, and that appointment is obtained by calling the MyCare Advice line. And what happens when you call that number is you'll be prompted for the Jackson area, so you would dial to be connected to the Jackson area, and a nurse who's located here in Jackson will ask screening questions, and based on the response to those screening questions, will determine if you need to be tested or not. And then they would actually schedule an appointment to come and be tested in that surface lot at 1 Jackson Square. The process is set up that way to help make sure we are prioritizing for the folks that are in the greatest need. Currently, the testing site is open to the community, and the criteria that we are using to make sure that we are testing appropriately are based on Cdc Criteria, and those include that people have to have symptoms. So those main symptoms: fever, cough, shortness of breath, some others that have been mentioned. Also, we want, in particular, to focus on people that have had travel to specific areas where we know there are higher incidence of disease, as well as exposure to individuals that are known to have cases of coronavirus. And also additional risk factors, and those include things like being over the age of 65, having other chronic diseases like diabetes or heart disease, or being immunosuppressed. So that might be folks with cancer or who take medications that cause immunosuppression. Even though the testing is open to everyone, we are prioritizing certain groups because those are the places where we need to make sure testing is completed so that we can complete an effective COVID response. And those priority groups right now are healthcare workers, which includes people who work in skilled nursing facilities, as well as first responders, because those are people that are really needed to help care for the critically ill. So right now, those are people that are being prioritized, even though the testing is open to everyone. I do want to emphasize that as more capacity becomes available, we are absolutely committed to making more tests available to everyone that we can. There is extremely high demand for these tests nationally, and so we are experiencing that same limitation that everyone is across the country in terms of access to these testing resources. But again, everyone doesn't need to be tested. People can safely be treated, recover at home without getting testing done. I have a few numbers for the drive-through site that I wanted to share. First, I'd like to share for just yesterday, actually, numbers that are most recent from the 25th. So we had 51 vehicles come through the lot yesterday at the 1 Jackson Square site. 44 of those were employees of our institution or of skilled nursing facilities and first responders. And we had 7 other vehicles that we had that we just provided education to because we didn't need to screen them or test them at that time. In total, since we opened the drive-through site starting on the 14th of March, we've had over 1,029, we've had exactly 1,029 cars that have come through the parking lot there to be provided services to. 619 of those cars have had an individual tested for COVID-19, and 410 of those have just received education. And then in total for employees, skilled nursing and first responders, we've had 114 individuals tested from this community. There are a few questions that I was asked to respond to. The first is, are we beginning to see results come back from the drive-through screening center? The answer to that is yes, and those are included in the total numbers that were already reported. So any of the positive results get incorporated into that total that we report here, and the county health department follows up with those individuals to help determine if they have been, or if others have been exposed to that positive case. Negative results to those tests, we have a nurse that actually will call and notify individuals of their results. People can also go online in My Chart, which is the online portal for Henry Ford Health System, and get the result there. Another question I was asked to respond to is, do we expect a change in the results as the week goes on? And we are just beginning to get really the first results back now. So we certainly expect that we will get more results, and we will probably get more positive results as time goes on. There's some delay here compared to other areas in Southeast Michigan, just in terms of the progress of this outbreak of COVID-19. So we should absolutely expect we'll get more positive cases. That's expected. I've already emphasized, I think, that we make sure that we will get you your results as soon as they're available. Those are available in My Chart again, and we have a nurse that's on standby and ready to call when those things come in. And then I wanted to make just one final comment, because I've got a lot of questions about this, actually from the employers in the community. We have a lot of employers here in Jackson County, and they're asking for work notes for their employees related to being tested. And the current guidance for that on the CDC is to not require your employees to provide notes of their illness to be removed from their work duties. This puts strain on healthcare resources that are already feeling pretty stressed at this time, given the current situation. So the CDC currently recommends that if an employee is sick and they have illness, that they should be allowed to take that 14 days to self-isolate to help prevent spread of the disease, both for them and their close contacts as well. And we are in a unique time period with a shelter-in-place order, and so the CDC has recommended that it is no longer necessary or shouldn't be necessary for employees to provide that confirmation from a healthcare provider to be allowed to stay home from work. So I just wanted to share that, because that's a question we've had a lot come up frequently. And with that, I'm going to actually turn back over to Dr. Smith.
Thank you, Dr. Katayan. Many of you heard the governor this morning, talk about load balancing and resource allocation across the state. I want to assure you that Henry Ford Allegiance has beds to take care of our community. We also are working with our Southeast Michigan Henry Ford hospitals for a surge capacity plan, implemented that, and are currently working through that process as we allocate those resources across our system. Overall, our Henry Ford Allegiance Hospital has 325 beds, and we normally function on a daily census of 270 or so. Today we had a census of 168. That most of that is due to the people taking care of themselves at home, and obviously not utilizing medical services, which is helping us manage the volume of evaluations that we are doing for our COVID patients in the emergency department, as well as admitting folks to the COVID units that I mentioned before. We've also set up a respiratory clinic at Townsend, walk-in clinic, which is designated for COVID-type complaints that the two physicians mentioned earlier. And specifically, if you're having symptoms of, again, new onset cough, shortness of breath, congestion, or fever, you can go to Townsend, and it is designated just for respiratory symptoms. Again, we are trying to cohort patients with similar symptoms to prevent spread from patients who may not have those symptoms. The respiratory clinic will see you on a walk-in basis. There's no appointment needed. And we want you to visit henryford.com /COVID-19 Jackson for more details. Related to updates around our personal protective equipment, we have, as of this morning, Technique Incorporated has produced 2,500, that's 2,500 face shields for us. Volunteers are continuing to make, and in coordination with Jackson Canvas Company, 115 protective surgical type masks. MKI Products in Jackson has also manufactured and delivered 20,000 filter inserts for those face masks. Again, a special thank you to Grand River Brewery for manufacturing the hand sanitizer and delivering that. Again, I will say that we have been inundated with folks wanting to help, and we have a process through the Henry Ford Innovation Institute to vet and make sure from an infection prevention standpoint these materials that we are using, the hand sanitizer, all those things need to go through a process to make sure they're appropriate and safe for our employees to use. Again, resource-wise, our community members can stay up to date on local COVID-19 information at our website, henryford.com/COVID-19 Jackson, or visit the full COVID-19 page at henryford.com/coronavirus. We did get 3 questions, and they are all for Dr. Hackert. So, Dr. Hackert, someone is asking if you've heard yet who attended the 2 events in Jackson County.
So that's why we put the press release out, was to notify everyone. We do know of the people who are now having symptoms. That's why I mentioned that 6 cases. There's also at least 1 other case associated with the community Bible study. For those people, they have been contacted, and we know who they knew there. But of course, there's many people who they didn't know there. So I'm not sure if that answered the question, but
I think that's great. And the other, there's 2 other ones. One is, are you aware of any other events that people may have been exposed to? And if so, will those be announced?
Yes, I will tell you when any events are known, but other than these 2 events, the other events were all, as I mentioned the last time, they were smaller events where the person who was infected knew exactly who was there and gave us all those contacts' names, and then those people were contacted and interviewed for symptoms and given information if they developed symptoms. So there are no other events that we are reporting at this time, but partially that is because we find out about those events as we have new cases, and then we interview those cases.
And so the last question is, and you did a little bit of this already, but describe the process in making sure that these events and the exposures are legitimate. Can you talk a little bit about how that works?
Legitimate. I'm going to interpret that word, making sure that they are legitimate, as in, did the event actually occur? And yes, these 2 events actually did occur. And then also whether or not there was truly an exposure, and that is yes as well. And the reason I'm saying that yes, that is a legitimate exposure is because we have confirmation that at least 1 person attended that event while symptomatic, and their test has come back positive.
Thank you very much. Again, in closing, I want to acknowledge and thank you to all the frontline staff and members of the community that are helping us manage and combat this coronavirus in our community. Thank you to all the support staff for keeping the rooms clean, keeping us fed, taking care of our employees as they arrive to work, screening employees as they come to work, and taking the daily business that keeps our health system going at the first priority. Know that we see it, and we are grateful, and thank you so much. Thanks also to Dr. Hackert, the Jackson County Health Department, and Dr. Katayan in his efforts for getting this information out to our community.
May I take 1 moment then?
You may.
Since this is a joint discussion, I would like to also give a little bit more of a detailed description and thanks to the people who are working at the health department. We have nurses who are investigating. As you've heard, they are calling every single person and getting all of their contacts, and they are also getting all of those people contacted. So they are working tirelessly to do this for the community.
Thank you. And again, thank you for attending and logging into our Facebook Live media event. We will have future events as this evolves. Thank you.